If I have hearing loss, does that mean I'm going to get dementia? That's a question that I hear quite frequently in my office. In fact, I just had that question earlier today. And I just wanted to take a minute to kind of explain what that really means. So, right now, we have a lot of information out there about the effects of untreated hearing loss, how that affects our brain, our cognition, our working memory, speech comprehension, things like that. So it's a very valid question and a very valid concern. The Lancet study that came out a few years ago showed that hearing loss is the number one modifiable risk factor at helping reduce your risk of developing dementia. If you treat your hearing loss in midlife, meaning in your 40s or 50s, you have a 10% reduction of developing dementia. However, that is only one factor, and we know that there are lots of risk factors and lots of things that can contribute to dementia overall. So, treating your hearing loss earlier in life, especially when you first start to notice difficulties, is going to have a huge impact when you get into your 70s, 80s, and beyond, because you're going to have had a chance to train your auditory system to help hear and remember what those sounds are, which will help you to have a better quality of life when you do get into those later years. But the important thing to remember is that if you have hearing loss, it does not mean you're going to get dementia. There's not a causation for that. It is a risk factor, and it does put you at a higher risk if you leave hearing loss untreated. If there are places that you go to, such as audiologists or other hearing care places, that tell you that if you don't treat your hearing loss, you're going to get dementia, I would definitely seek a second opinion. So I hope that's helpful, and I hope that kind of helped answer the question of, if I have hearing loss, will I get dementia? The answer is not necessarily, but it does increase your risk. Thanks. Bye.